Once again, thank you for joining us, and my name is Dr. Cheryl White Scott. Please remember to use the chat box to ask us questions, provide insight on your experiences, and share resources. As I mentioned earlier, my experiences over the last 30 years as a primary care physician providing care for individuals with developmental disabilities expose the many barriers individuals with IDD experience, especially in the area of adult health services. Historically, we have the outcomes on barriers from the Surgeon General's Conference in 2001, data from Special Olympics, more recently the data from my colleagues Dr. Gloria Cron and Dr. Susan Haverkamp, which reflect the common themes of a lack of information and training for educating health professionals in the area of developmental disabilities, a lack of accessible equipment, a lack of appropriate patient care materials, just to name a few. Patients and families that I have had the honor to serve express ongoing frustration with the quality of healthcare services. For example, when I asked one of my patients, what would you want me to let doctors know who are in training? She simply said, listen to me. Just because I have cerebral palsy doesn't mean I don't know what I'm saying when I'm sick with a cold. Collaborating with my colleagues at the Boggs Center on this New Jersey Developmental Disabilities Filing Council grant, building capacity to improve adult health care services for patients with intellectual and developmental disabilities, was a natural fit with my expertise and my efforts to address health disparities for adults with IDD over the last 30 years. As Dr. Spitelnik described, the project used a tiered approach, with my focus being grand rounds and case conference format for educating health professionals. In determining the best format, we organized a focus group of general internal medicine faculty at Rutgers Robert Wood Johnson Medical School. We were concerned about whether or not participants would be forthcoming during our focus group, especially on a Thursday morning after their departmental rounds. As I usually do with educational forums, I used a case-based format to open us up, which was helpful for discussion. We were impressed by the openness and the candor of the doctors. One that was a natural fit for one doctor who was also a mother of a child with developmental disabilities, and she expressed her need for assistance with her patients in the adult healthcare setting that she worked in. The other doctors that may not have had a personal experience still were very willing and expressing their needs. Common themes quickly emerged with their reporting of limited knowledge and ability to communicate with patients, presenting problems often with limited historical information with the staff that came with them, difficulties with a lack of resources in the hospital and in the community, especially in behavioral health and the dental area, and a lack of tertiary or backup consultation information. Not being able to weigh a patient with disabilities because there is no accessible scale is a major barrier to providing quality healthcare services, and just one of the barriers that was presented. Their willingness and their request for more information aligned with our project to develop grand rounds and case conference formats to continue to build capacity and begin to fill these gaps. In addition, we had provided information on available community resources and began to work on how best to proceed. And then our world collapsed. It changed both professionally and personally with the cases of COVID-19 hitting the United States shores approximately in January, and in New York approximately the beginning of March. My first case of COVID-19 was an individual with Down syndrome, dementia, and respiratory compromise. I sent her to the emergency room due to a temperature and hypoxia, low oxygen, thinking possibly strep infection or influenza, but worrying about COVID-19. She was diagnosed on March 17th, and she died in the ICU 2 weeks later on April 1st. Her mother thanked us for the care, and I thanked her for the privilege of providing clinical services to her daughter. In my 30 years of practice, I have never had sicker patients. I've never had so many patients in the hospital at one time and experienced such heart-wrenching deaths. with patients dying separated from familiar friends, family, staff, and yes, familiar healthcare professionals. Frontline staff, both in the hospital and out, were heroic and worked with minimal supports, but also to keep us all going. COVID-19 ripped off the cover on the health inequities and the disparities for many vulnerable populations, and especially for people with IDD, but also presents us with an opportunity to continue to work on educating health professionals about individuals with DD and also work on correcting these glaring health disparities. Recent medical information, for example, core competencies for health professionals by the Alliance, ADDMD's COVID-19 webinars, mortality risk in developmental, COVID-19 mortality risk in Down syndrome from the UK, Annals Brief Research Report, and the recent JAMA article on medical care for adults with Down syndrome give me hope and give us improvement in the guidance, awareness of needs, educational resources, data, and further research needs for individuals with IDD. So this brings me back to where we started this segment, emphasizing the fact that we need to know the many barriers and also acknowledge them, but also move forward on solutions. This grant started a process and identified needs that we only have begun to address. This clip of the grand rounds, done virtually because of COVID-19, uses a case-based format to engage adult healthcare practitioners and provide answers to clinical challenges, as well as encourage dialogue to improve the quality of life for individuals with IDD. Please note this was done for physicians, so their language and the terms are medical, but it gives you just a quick view and an idea of one of the vehicles we can use to fill the gap in medical education. This was early on in the pandemic that it was taped, so I beg your indulgence with the technical glitches, and I again thank my family as tech crew. But most importantly, let us continue to work together now in the era of COVID-19 and in planning for our post-COVID-19 world. Please remember to share your questions, concerns, or thoughts in our chat box that we can respond to. Thank you.